So my presentation is on the validity and reliability of the load velocity relationship to predict the one rep max in deadlift. So introduction. The research was necessary because a 1RM can be determined in two ways, either directly or indirectly. Direct assessment of 1RM can be described as a trial and error procedure where weight will be added until no further repetition can be performed. This approach, however, is time consuming, puts athletes at increased risk of injury when performed incorrectly, is impractical within large team settings, and can induce muscle damage and fatigue, potentially deteriorating training performance on subsequent days. Therefore, regression equations to estimate the 1RM based on the maximum number of repetitions performed to muscular failure with some maximal loads have been established to try to predict a true 1RM. The purpose of this study is to use this regression equation that is using data from the submaximal loads to predict the 1RM on deadlift. Methods. The participants included in the study consist of 11 healthy male resistance trained athletes with an average age of 23.6 years, average height of 1.8 meters, and average body mass of 85.6 kilograms. All subjects were free from any musculoskeletal disorders and at least 1 year of resistance training experience, and were able to perform the deadlift with at least 1.5 times their body mass. The subjects performed 3 testing sessions separated by at least 72 hours. Before each 1RM assessment, a standardized warm-up consisting of 8-minute dynamic lower body mobilization exercises, followed by 3 warm-up sets of 3 repetitions with a 25 kilogram of deadlift. Subsequently, subjects were provided a 3-minute passive rest. The submaximal testing comprised of 3 repetitions at 20% of the 1RM, 3 repetitions at 40% of the 1RM, 3 repetitions at 60% of the 1RM, 1 rep at 80% of the 1RM, and 1 rep at 90% of the 1RM, followed by the actual 1RM attempts. After each successful 1RM attempt, the barbell weight was increased in consultation with the subject by 1 to 5 kilograms until either no further weight could be lifted or the technique deviated significantly. These submaximal values are used to predict the 1RM in sessions 2 and 3. Barbell displacement with respect to time was monitored by commercial linear position transducers called GymAware. The tether of the GymAware device was attached to the middle of the barbell perpendicular to the ground and between the subject's feet. Results. When analyzing the whole data set, 132 data points for sessions 2 and 3, there was an almost perfect linear correlation between mean concentric velocity and relative loads. Similarly, there was almost perfect linear correlation between mean concentric velocity and relative loads for all submaximal load ranges. Individual linear correlation coefficients across all submaximal load ranges and subjects for session 2 and 3 range from R equals 20.983 to 20.999 with an average of R equals 20.998. Furthermore, we observed very high ICCs and small coefficients of variation of 5%. For the actual and all predicted 1RMs, typical error ranged from 3.4 and 7.5 kilograms, with the best typical error noted for the actual 1RM and the worst reported for 40 to 80% of a 1RM. Calculated ICC coefficients 0.63 and CV were moderate and high, respectively, whereas the observed typical error was 0.029. The correlation coefficients for predicted and actual 1RMs were very large to almost perfect for all submaximal load ranges. Absolute error ranged between 9.1 and 13.7 kilograms, with 40 to 90% of 1RM showing the highest and 20 to 60% the lowest accuracy to predict 1RM. The authors concluded in their findings that all prediction models in the actual 1RM showed high reliability. All prediction models tended to overestimate the actual 1RM by 5 to 10 kilograms, with submaximal ranges performed at higher loads, showing slightly higher accuracy. Individual variation in the accuracy to predict the 1RM was high, with only 4 subjects displaying sufficient levels of accuracy, especially at higher submaximal loads. Discussion. Present findings indicate that the 1RM is highly reliable measure for maximum strength in deadlift and resistance trained athletes, as noted by trivial changes between sessions alongside an almost perfect correlation and a low typical error of measurement expressed in both raw units and as a coefficient of variation. It is important to highlight, however, that data from the study indicate that all predicted 1RMs were less reliable than the actual 1RM. Thus, if the 1RM prediction models were to be considered as a sensitive monitoring tool, changes in predicted 1RMs would need to mimic the change in the actual 1RM, with the magnitude of change being bigger than the typical error of measurement of the predicted 1RM. The results of this study questioned usefulness of linear prediction models based on submaximal loads to estimate daily 1RM in the free weight deadlift. Although 1RM predictions were highly reliable between sessions, they consistently overestimated the actual 1RM. My opinion is using the linear model, using submax values to predict 1RM deadlift is a good way to predict a ballpark area on where maximal strength should be. But any given day, there are several factors that can affect the maximal strength of a subject, including stress, internal problems, and day-to-day routine. This study can help a professional in practice because it shows the data on where a 1RM deadlift should be at and can help accurately predict within a few kilograms the actual 1RM.